My patients often have a problem. They have a hard time understanding the nature of focused shock waves. And despite my explanations, they still come away thinking it's electrical shocks. And that is not true. I'm Dr. Stefan Buntrock, board-certified urologist and specialist in sexual medicine. In my office, I have used shock waves since 2017. They are a unique form of treatment unlike any other therapy in medicine. I use them mainly for erectile dysfunction and pelvic pain. But shock waves have a very wide range of medical applications. In this video, I will explain what focused shock waves are. They are a very specific kind of acoustic waves with unique properties. So not the audible sound and not ultrasound treatment either. They are not electricity, although the word shock may make it sound that way. And indeed, they feel like small electrical shocks or needle pricks. Medicine has known shock waves for almost 50 years. They became popular in the 80s for breaking kidney stones. You all have heard shock waves, but without realizing it. When an airplane breaks the sound barrier, there is a loud boom. You all know the feeling of that wave making your window panes shake. This boom is caused by a shock wave. During World War II, submariners could be injured inside their boats when depth charges exploded nearby. The underwater shock wave struck the hull so violently that crew members suffered ruptured eardrums, contusions, and even internal injuries. What you can see from these examples is the enormous pressure created by these waves. That's the shock part. In medicine, we harness this physical force in a precisely controlled and carefully dosed form. You may have heard about low-intensity shockwave therapy, or ESWT, extracorporeal shockwave therapy. And that's why. Inside the body, an extremely short and extremely steep pressure pulse sweeps through the tissue. This happens within microseconds. The positive pressure peak is followed by a much smaller negative pressure phase. In simple terms, a rapid push and pull. In the right dose, this push and pull is a powerful mechanical stimulus that can activate the body's repair mechanisms. The shock waves I'm talking about here are focused. Imagine a magnifying glass. You bundle sunlight into one small spot on the ground. The sunlight becomes so concentrated that you can light a fire with it. Focused shock waves use a similar idea. The machine creates pressure waves and directs them so that they converge in one small area inside the body. Not exactly one mathematical point, it is more of a small three-dimensional zone, the focal zone. Where that zone is positioned differs from device to device. Some devices use spacers, such as this. In others, changing the intensity setting also shifts the focal zone deeper into the tissue. The machines also use curved arrangements, reflectors or lenses to concentrate the waves. There are three basic mechanisms for producing focused shock waves. They are called electrohydraulic, electromagnetic, and piezoelectric. In simple terms, they use either a spark between electrodes, an electromagnetic coil and a moving membrane, or a large number of crystals. And of course, all of them need electricity. But here's the important point. The electricity stays inside the machine. What enters your body is not electrical current, it is an acoustic pressure pulse. These machines also use a fluid coupling medium, usually water, and this is why we put gel between the treatment head and your skin. The gel is not there to conduct electricity, it removes the air. Even a small air gap would prevent much of the shockwave energy from entering the body. This is why I ask my patients to remove body hair in the treated areas. Hair can trap air between the treatment head and the skin. These small air pockets block part of the shockwave energy from entering the body. Now I would like to address a very important distinction. Focused shock waves are not the same as radial pressure waves. Both are commonly marketed under the Shockwave label. Sometimes radial pressure waves are referred to as radial shockwaves or RSWT. Most of these devices are ballistic. A projectile is accelerated inside a tube and hits the transmitter at the tip of the applicator. The resulting pressure pulse is physically very different from a focused shockwave. It starts at the skin surface and spreads outward into the tissue. It is not focused inside the body. Because the physical stimulus is different, we should not simply assume that the biological effects are identical. In strict physical terms, focused shockwaves are the actual shockwaves. Radial devices produce pressure pulses. Radial pressure wave therapy is a different technology. At the cheap end of the market, you can even buy devices sold for home use. They may carry the same shockwave label, but they should not be confused with professional medical systems. I bought one of those on Amazon and tested it in a professional testing lab. It went through a mutation and became Li-ESWT. Whole story in this video. I'm Dr. Stefan Buntrock, still copied by faceless AI channels, but never matched.